Hi, this is Kim Skelding from Geisinger Health System. In my 1 minute, I want to talk with you a little bit about mentorship, so vitally important to the success of your career. For me, getting advice about procedures, getting advice about jobs, getting advice about life choices, those are vitally important. My mentors over the years, Dr. O'Neill, Dr. Grinds, Dr. Holmes, Dr. Nabel, Dr. Moran, have helped me make decisions. What job, which procedures to engage in, which research to do, even about life, where to live. Very important. And the second most important piece is then pass it on. You need to find people to mentor after you've been mentored. It's really a gift that you give the cardiology community.
Good day. I'm Dr. George Vetrovec, Professor Emeritus at VCU Medical Center, interventionalist of many years, going back to the very early days. As I look back and think about all the patients I've taken care of, while we're all so interested in emphasizing technology, and that's very important, these are real patients. And I also have taken great pride in knowing my patients. But I sometimes still don't think we do it as well as we should. And I've been amazed over the years when I thought I had patients that I had been particularly involved in their care and really thought I knew them. And then when they died or were written up in the newspaper in some way, I suddenly realized there were whole aspects to them that I didn't know about and that were fascinating, and I just wished I had had a couple more minutes. So my advice is, as busy as we are, if you can spend 5 more minutes with your patient, I think it's rewarding.
All you guys are worrying about where you'll train, how expert you'll be in one procedure or another. Some of you will have to take leadership roles in your hospitals, in organizations. And so my experience is, my greatest learning experience in leadership was in the Army. I had a medical company in Vietnam, not proud of that war, but proud of what I learned. And what I learned was that people respond to leaders if you lead. And it's very simple. If you don't lead, people aren't interested. And so these are learned techniques. You can become a leader if that's your interest. And some people need to do that. The other thing I learned was, to get things done, never go to the generals, go to the sergeants. And I mean that your cath lab technicians, your assistants or secretaries, we used to call them. These are the people who really make things happen. So if you're going to be an effective leader, cultivate the people who actually do the work and get things done. That's my advice.